name is Ann Hepfer. I'm the health officer for Huron and Tuscola County Health Departments. This is March 12th at 4:30 p.m. We're here today to give you an update on COVID-19 from a local perspective. Sitting with me today, I have Dr. Mark Hammond, who is the medical director for Huron, Sanilac, Tuscola, Lapeer, and District Health Department number 2. He is also a practicing emergency physician and hospitalist at Mackenzie Hospital in Sandusky and Henry Ford Hospital in Detroit, as well as the president-elect for the Michigan Academy of Family Physicians. Dr. Hammond, would you take it from here and give us an update on what you, as you know it, for COVID-19?
Thanks, Ann. So COVID-19, also known as coronavirus 2019, started off in China, Wuhan, China, migrated towards us here in the U.S. and Michigan. There's so far been 2 confirmed cases in Michigan, one in Oakland County, one in Wayne County. Both have been travel-related, as far as we know. There is no known community spread as of this very moment, which community spread means that people in the community are getting it without any known travel risk factors. However, we're not sure if that will change or not. So in light of that, we have general precautions to help prevent against contracting this virus. So we do know the virus is spread through respiratory secretions, droplets, meaning coughing, sneezing, and even existing on some solid surfaces for a matter of hours. So it's very important to wash hands thoroughly with soap and water for at least 20 seconds with warm water, use of appropriate hand sanitizers with at least 91% alcohol concentrate on there, and like avoiding close contact within 6 feet, large crowds, these things. In those who are known to be sick with symptoms such as fever, cough, pretty much your cold-like symptoms or flu-like symptoms, stay at home. Don't expose to others. And it's very important that if you do have these symptoms and you do have some travel-related risk factors, such as being to any of those known endemic countries such as China, Iran, South Korea, Italy, within the past 14 days, to call your primary care provider's office before going there, or call your local ER before going there. Give them the heads up, hey, I have been to these places, I have these symptoms, before you actually go there in person, so they can prepare efficiently for your visit there, protecting themselves as well as other patients and yourself as well.
Dr. Hammond, could you give us a little update on what people can expect when they go to their provider to be tested for COVID-19?
Right, so if they do meet the risk factors for testing, their provider will end up doing a nasopharyngeal swab or an oropharyngeal swab, which pretty much is like a long Q-tip that would insert into their nose or their mouth for testing for the virus.
And my understanding is a pretty good quick turnaround.
This is a quick turnaround, correct.
And if the provider believes that they do have COVID and they're testing them, then they will be quarantined. They have to understand that they'll be quarantined, correct, until we get the test results back.
Exactly. So the big concern is that if you do have this disease, it's spread very easily too. So the safe thing to do, the responsible thing to do would be to self-quarantine or home quarantine, be in isolation from other people so you don't spread this to others. So that would be, your provider would have you stay at home and keep everybody in touch with what's going on.
Okay, thank you. So with that being said, Public Health is asking you to be prepared, which means if you're going to be home for 14 days, you need to be prepared for 14 days to be home. So making sure that you have enough food, hygiene supplies, dog food, pet supplies, anything that you can think of you would need if you were preparing for a bad storm and you were going to be snowed in for 2 weeks and you couldn't go out, that's what we need you to have at home. And this might even include cold medications, cough syrups, just general cold medications, some Tylenol, some Advil, because with COVID-19, you will most likely be running a fever, correct? And they will have a cough. And so what you generally would take for a cold at this point is what is being currently recommended, correct?
That's correct.
So that 2 weeks is a long time. Also, this is a great time also to have a discussion with your employer. What do they expect from you? We expect that when you are sick that you're going to stay home. Let's make sure your employer is on the same page as you are with that. If you have any additional questions or concerns, you can go ahead and comment on the Facebook page, and you can visit each of your health department's websites for further information and links from CDC and Michigan Department of Health and Human Services. Thank you again. Be safe.